Thank you, Doctor. One of the things that you did in West Virginia was to create overdose review teams. I think you called it opioid autopsy. What should I should flag that Senator Cornyn and I have a bill on this, the Overdose Review Team Act. How important is it for the federal government to support overdose review teams?
Thank you, Mr. Chairman. It is very important that we understand the science and the data behind millions of people suffering non-fatal overdoses, because what we found in West Virginia, 4 out of 5 people came in contact with the healthcare system before they died. It's us who failed them, not the other way around. So we've got to figure out what's happening to people in communities, in neighborhoods, and be able to solve those issues at that level.
We have done a good job, I think, in Rhode Island trying to make sure that anybody who comes into an emergency department with an overdose is assigned to a peer recovery specialist. It doesn't always work. They don't necessarily always want to talk, but the opportunity is there, and I think it's made a big difference. We look forward to working together to get our bill passed into law. Telehealth was something we learned a lot about through the COVID epidemic. And we want to make sure that the capacities and flexibilities of telehealth that were established during that period continue. Do you support the continuation of telehealth flexibility in opioid treatment?
Yes, Mr. Chairman, I think one of the great things that has happened from the first year, right from the first day onwards of this administration, is providing that flexibility to communities in being able to provide telehealth as one of the weighted solutions. The strategy, make sure that that happens and continues to happen, because getting to remote areas, especially rural areas, is very critical, and telehealth is one way to get there to help advance treatment.
We had enormous success in Rhode Island with our incarcerated population reducing deaths by over 60% by beginning treatment pre-release and seeing to it that there were supports post-release. Are you comfortable that the Bureau of Prisons has stepped up as it should to deal with the population that is exiting incarceration and re-entering society?
Yes, Mr. Chairman, there's a lot of work happening that I know of right now with Bureau of Prisons, DEA, SAMHSA, HHS, and us working to lead that effort to ensure that we can walk the talk when we talk about universal treatment. So we're working aggressively to make sure that we have systems in place where no one within the federal correction system is denied treatment, because we know that has a direct impact on society, both in terms of reducing recidivism, reducing overdose, and improving the cost. It's just the cost of the system that it costs us. So,
are you satisfied with the Bureau of Prisons response?
Yes, so far we have a great working relationship. I'm looking forward to having a significant amount of success in this.
This is probably more our problem than yours, because at its heart it's a funding problem and we provide the funding. But everywhere I go around Rhode Island, I hear the same concerns about workforce, and particularly in the caring professions workforce, whether it's healthcare or elder care or child care. And it's particularly acute, I think, in mental health and in substance treatment. And in part, I think we take advantage of people who, for reasons of personal commitment, are willing to operate in jobs that they're compensated far less than they're worth, but their sense of inner motivation keeps them there. But it really isn't fair to them to take advantage of that and not pay them salaries that are worthwhile. What do you think the key steps are that Congress should take to support the substance treatment workforce and to make sure that salaries are commensurate with the kind of service they provide?
Thank you, Mr. Chairman. Clearly, the importance of workforce in addiction is important. We have 23 million Americans that are in recovery today, so peer recovery support groups are important. There's a lot of work happening within the part of the strategy, which is making sure we have apprenticeship, loan repayment programs. People get support to serve in underserved areas, folks with licenses, but other workforce that we're going to need in terms of social workers, and making sure we have navigators. All of those things are going to be very important.
And they're part of the focus of your strategy?
Yes, yes, Mr. Chairman.
So last question. There are two sides of the business. of international drug trafficking. One is producing and distributing the unlawful drugs themselves. The second is collecting the money that you get paid at the sale and bringing it back and then investing it or putting it to use in whatever ways. My experience as a prosecutor has been that we put an enormous amount of effort into the first part of the business, much less effort into the second part of the business. And in my view, the second part of the business, the financing of international narcotics trafficking, is enabled by a structure, an international structure of dark economy that can hide the loot of kleptocrats, the funds developed by criminal trafficking networks, whether it's human trafficking or drug trafficking, terrorist financing. And I hope that as you look at the financing side of these international networks, you are attentive to this larger question of the common infrastructure that all of these evil efforts use in order to obscure where they've got their money, to hide that they have the money, to avoid taxes and accountability. We need to have a very significant moment of international transparency, and I think that will redound very effectively into our enforcement against international traffickers.
Thank you, Mr. Chairman. One of the top priorities, one of the top 4 priorities is what we are now calling commercial disruption. That involves looking exactly at these businesses as commerce and going after their profits. Going after denying them the profits helps us make sure that we're removing the real motivation behind their model first. And secondly, we're disrupting their operating capital. That also works to dismantle and disrupt their functioning every day. Part of that's been the executive orders that President Biden signed in late December. We have already had sanctioned about 26 individuals and 17 entities since, all of which are fentanyl related. Many of those tranches include the Sinaloa and CJNG cartel members. And the whole idea is exactly that, to go after the both in the production of it, but also the proceeds. So now we're able to go after not only the traffickers, but their financiers, their enablers, their trust agents, their lawyers, their accountants. All of that activity is going on. Thank you.
Senator Grassley.